So the next topic which we are going to start is acquired cataract in the lens. What is acquired cataract? What are the types of acquired cataract basically? So what are the types of cataract? These are acquired and congenital. Basically in this session we are going to study about the acquired cataracts. Acquired cataracts are basically of four subtypes. These are metabolic, traumatic, complicated and senile cataracts. Okay, these are the four types of acquired cataracts. Let us see. So cataract, the word basically means opacity in the lens. Okay, so anything got deposited in the lens, anything got accumulated in the lens, leading to cataract formation. Okay, so basically there would be an opacity if anything got deposited or accumulated in the lens, and this phenomena is known as cataract. The most common cause of gradual pain loss of vision. Okay, this is cataract. The most common cause of gradual painless loss of vision is cataract. So basically we can conclude by this line that cataract is painless condition. Okay, and it gets into gradually. Okay, and there is a loss of vision or opacity due to cataract. The most common cause of blindness in India is cataract. Okay, remember this point. Many students go with glaucoma as an answer, but it is cataract. It also leads to blindness. Okay, so blindness, according to 2017 guideline, it has been changed. So what is the program now being of blindness? It is NPC BVI. Okay, that is National Program of Control of Blindness and Vision Impairment. Okay, so the new thing added in the program is visual impairment. Okay, so this is the program NPC BVI. Now what definition does the blindness have been concluded by the NPC BVI? That is visual, the visual acuity in blindness is less than 3 and more in 60. So less than 3 by 60, this is the visual acuity concluded by the program of blindness. Okay, now the visual field, it could be concluded as less than 30 degrees. So you can say it visual acuity as less than 3 by 60. Firstly it was 6 by 60, now it is 3 by 60. The visual field is now less than 10 degrees. So these are the definitions given by the NPC BVI. Okay, now what are the risk factors of the cataract? So on the distinguished basis we are going to see the risk factors, and the pathomechanism of the loss of transparency. Now the risk factors of cataract could be a increase in age, it could be due to sunlight, due to severe diarrhea and dehydration. The most important, it could be due to vitamin A, C or E deficiency. Okay, it could be due to diabetes, due to smoking, corticosteroids and genetical factors. So these are all the risk factors of cataract. The most important one amongst these is the age factor, sunlight factor, vitamin deficiency, diabetes and smoking. These are the main important risk factors associated with cataract. Now in the increased age, the oxidative, there is an oxidative damage to the membrane and the protein. Okay, so in age related risk factor, how it leads to the cataract? So basically there is an oxidative damage to the membrane and the proteins which leads to cataract. In sunlight, due to dehydration, it leads to cataract. Okay, so due to sunlight exposure there could be a dehydration in the eye that would ultimately lead to cataract. severe diarrhea and dehydration. So there would be denaturation of the protein that would lead to cataract ultimately. The most important one, vitamin A, C and E deficiency, it leads to opacity of the lens fiber with fibrous metaplasia. Remember, there is fibrous metaplasia if there is a deficiency of vitamin A, C and E. That would ultimately lead to cataract only. Okay, now diabetes is a risk factor for cataract. So diabetes, what it does, it does the opacity of the lens epithelium. Okay, so the lens epithelium opacity, that is affected by the diabetes. Okay, and which ultimately lead to cataract. Smoking as a deficiency factor, so pigmented molecules get accumulated inside the eye and that finally leads to the cataract. Okay, very simple. An important point, smoking as a risk factor. The next comes is corticosteroid therapies. Corticosteroid therapies are also a risk factor for cataracts that ultimately disturbs the in the balance. Okay, so there is a disturb in the balance inside the eye that would lead to cataract formation due to corticosteroids. Now there could be some genetical factors that would lead to failure of the iron pumps, and these pumps, there would be a increase in the calcium and sodium level, and there would be a decrease in the potassium level. Due to the increase in the calcium and the potassium level, it would ultimately lead to cataract because the calcium and the sodium will be deposited inside your eye and that would lead to cataract. So genetical factors by failure of the iron pumps. So these are all about the risk factor which leads to cataract. Okay, now the first amongst the acquired one is the metabolic cataract. Okay, so firstly we'll talk about the diabetes mellitus which causes cataract. So diabetes mellitus causing cataract, what would be the appearance of the eye? So snowflake cataract. Diabetes mellitus causes snowflake cataract, or you can call it as a cortical cataract also. Okay, and this diabetes mellitus, it is which type of diabetes? So it is type 1 type of diabetes mellitus, and most commonly it is seen in young adults. Okay, this type of cataract due to diabetes mellitus, that is seen in young adults. And which type of diabetes mellitus? Type 1. Now the next cause of the diabetes mellitus leading to cataract, it is pre-senile cataract. Okay, so diabetes mellitus can cause snowflake cataract, or it could cause pre-senile cataract also. Okay, now the word senile itself means and tells you about something related to the age. So basically this pre-senile cataract, this cataract would be seen before the age of 50 years of age. Okay, so pre-senile cataract seen before the age of 50 years of age, and it occurs due to increase in carboxylation of crystallines. So there is a carboxylation of the crystallines. This increases due to which presenile cataract is caused. Okay. So another cause of diabetes mellitus, it is fluctuation refractive error. Okay. So in this image you can see the snowflake cataract. Okay. So this is a snowy deposition over here, you can see at the periphery. This is nothing but whitish color, that is snow. Okay, so the appearance is like in snow, so called as snowflake cataracts. Same you can see over here, snowflakey appearance over here. Now another thing in the metabolic cataract, first was our diabetic mellitus. Then comes the galactosemia. Okay, so galactosemia, it can also lead to cataract. Which types of cataract can galactosemia cause? So these are oil drop cataract, and this oil drop appearance is at the posterior aspect, so called as posterior subcapsular cataract. Okay, so you can clearly see this is the posterior surface, and this whitish color, this is an oil drop appearance cataract. Okay, so called as posterior subcapsular cataract. Now this is an reversible cataract. Very important point over here. This is a reversible type of cataract. Which type? Galactosemia cataract. Okay. The next comes is myotonic dystrophies, which leading to cataracts. So what all causes are there of myotonic dystrophies? These are Christman's cataract. First type of cataract caused by myotonic dystrophy. The Christmas cataract is also known as posterior subcapsular cataract. Okay, and why it is called as Christmas cataract? Because it appears like a Christmas tree over here. So basically the decoration of a Christmas tree, which is irregular, it appears like that. Okay, so the irregular decoration of the Christmas tree, it appears like that. This is the image for it. Now another type of cataract which is caused by myotonic dystrophy, these are presenile cataract again. Okay, then the next thing comes is Wilson's disease or parathyroid tetany. Okay, this can also lead to different types of cataracts. Okay, so Wilson's disease or parathyroid tetany can lead to or can cause sunflower cataract. Okay, in sunflower cataract there is a deposition of cuprous oxide. Okay, very important point. The cuprous oxide gets deposited in such a manner that the appearance is like a sunflower. Okay, this is the image. You can clearly see a sunflower and fine dots in the between. Okay, so totally a sunflower appearance. A point over here that this sunflower cataract is the deposition of cuprous oxide, and it can be at a multiple site of the lens. Okay, remember, it can be at multiple sites of the lens. This deposition of cuprous oxide can be at multiple sites of lens. Now it is stellate shape also. Okay, so not only sunflower shape, it is also called as stellate shape. Now the next type of cataract it can cause is Kaiser Fleischer's ring. Okay, so the appearance of the cataract would be like a Kaiser Fisher ring. Okay, and this is due to again deposition of copper. Remember, this is copper oxide, and here the deposition is of copper. Okay, and here the deposition of copper is in the membrane of cornea. Okay, so at the peripheral aspect of the cornea there is a deposition of copper, which leads to a formation of a ring called as Kaiser Fleischer's ring. Very important. So you can see in this image Kaiser's Fleischer ring. Okay, so this ring, basically this ring, this is nothing but Kaiser's Fleischer ring, and it is where it is situated at the periphery of the cornea. Okay, so you can see this is the periphery of the cornea and it is situated over here. Kaiser's Fleischer's ring. Now what is the diagnostic method? So it is IOC, and we do this thing in 24 hours of urine copper level. Okay, IOC is done by checking the 24-hour urine copper level, so that we can check that how much of copper is excreted by the patient. By that we can diagnose it. Now the next, parathyroid tetany, it can lead to hypocalcemia. Okay, so in parathyroid tetany it can lead to hypocalcemia, and this can cause anterior and posterior subcapsular cataract. Very important. Okay, parathyroid tetany leading to hypocalcemia, which can cause anterior and posterior subcapsular cataract. You can also call this term as laminar cataracts in children. Okay, so basically it is indicating that it is in a particular age group, children. Another type of cataract, the next second one comes the traumatic cataract. Okay, now traumatic cataract name itself is telling us that there would be a blunt trauma, or it could be by a infrared radiation or any lightning or electric shock, which can lead to a traumatic injury in the eye, which finally lead to cataract. Okay, so the first comes is the blunt trauma, which causes the cataract. And which type of cataract is formed by the blunt trauma? It is rosette shaped cataract. It is rosette shaped cataract. You can also call this cataract on the by seeing the position of this cataract as posterior subcapsular cataract. Okay, so this is the image. You can clearly see over here a rosette pattern. This is being formed over here. This is nothing but rosette shaped cataract. Okay, here also you can see a flower forming in the eye at the part of the lens, and this is nothing but rosette shaped cataract. Okay, the next cataract could be due to infrared cause. Okay, so the next cause could be infrared radiation. This leads to glass blowers cataract. Okay, so the first time was blunt injury trauma, which was the cause, and it was leading to rosette shaped cataract. The next is infrared. This is the cause, and it leads to glass blowers cataract. It occurs, this glass blower cataract, it occurs due to true exploitation of the lens capsule. Okay, so there is an exploitation of the lens capsule, which ultimately leads to glass blower's cataract. Okay, the next cause of traumatic cataract is lightning or electric shock. Okay, this can also lead to traumatic cataract, and on the basis of the position it is anterior capsular opacity. Okay, so at the anterior capsular level there would be a opacity in the eye. Okay, now the next type of cataract, the third category that comes is complicated cataract. Okay, so it is basically a complicated cataract. Now the causes of this cataract, the most common cause of complicated cataract is uveitis. Okay, there is an inflammation. Now, so the first part where we studied this inflammation, it could be also due to myopia. It can be due to angle closure glaucoma. Okay, so the most common cause uveitis, myopia, angle closure glaucoma, and the fourth cause and the last cause is retinitis pigmentosa. Okay, so basically you have to remember the most common cause of complicated cataract, and that is uveitis. Very simple. Now the appearance is in complicated cataract, it is breadcrumb appearance, and it shows light. Okay, on showing light the eye appears as bread crumb appearance. Okay, the crumbs, that means small particles of bread. Okay, small particles of bread scattered inside the eye, it looks like that. Okay, so on showing the light inside the eye, this appearance is seen. Okay, now Polychromatic luster is noted. Okay, so nothing but polychromatic lusters are present inside the eye in a group, and so it is breadcrumb appearance. Now, what is the site? This is the main important thing. It is posterior subcapsular cataract. This is posterior subcapsular cataract. The previous one which we studied, that was anterior capsular cataract. Okay. The next cataract comes the senile cataract. Very important. Senile cataract, also known as nuclear cataract pathology. Okay, so nuclear cataract pathology. The name itself tells you. In senile cataract, we are going to discuss about that it is related to age group. Okay, so senile word tells us about the age group. Now, the another term used for senile cataract is nuclear cataract pathology. So basically there would be a pathology or a accumulation in the nuclear part. Okay, we have discussed the study of the lens. Okay, so at the nuclear part of the lens there is going to be a pathology, and which would be a age related phenomena. This is the meaning of senile cataract. Very easy. Okay, now it is also known as age related cataract, as we studied. Okay, and it occurs around 50 to 70 years of age. Okay, now it is further of four types. It is further of four types. The first one is nuclear cataract, also known as central cataract. The clinical feature for the nuclear cataract is loss of vision in the daytime. Okay, now there is a loss of vision in the daytime, but in the night time or in a dim light, the vision improves. And this condition is called as senile cataract. Which type? Nuclear cataract type. Okay, so if the patient comes with a complaint of loss of vision in a daytime and improved vision in a dim light or a night time, then this would be a nuclear cataract. Okay, now what is the pathogenesis of nuclear cataract? The most important thing. So in one word, if I want to say the pathogenesis, it is due to sclerosis. Nuclear cataract is due to sclerosis. Okay, and on surgical methods you will find that in nuclear cataract there is going to be a hard cataract. Okay, so due to sclerosis there is hardening which leads to a hard cataract. Okay, and this is nothing but nuclear cataract. Okay, so basically in nuclear cataract you will see hardening. Okay, so called as hard cataract, and this hard cataract is due to the deposition due to sclerosis. Very simple. Now when there is a sclerosis, it will increase the refractive index inside the lens. Okay, and we have studied about the refractive index in our previous lectures. Now there is a increase in the power. Due to increase in refractive index, there is going to be a increase in power, and the converging of the light of the lens would increase ultimately. That is why there is increase in the power. Now the it will lead to index myopia. Okay, so index myopia, what is this? This is nothing but the patient will be suffering from a far vision loss and near vision. He can see the near vision but the far vision is lost. Okay, so the near vision is sightedness which leads to the second sights. Okay, so basically there is a loss of far vision and the patient is now able to see of near vision which will lead to second sights. Okay, now what is the second sights? It is improvement of the near vision due to nuclear cataract. Okay, basically the patient was primarily suffering from a near vision loss, but now due to nuclear cataract the near vision has improved in a patient who is already of presbyopia. Okay, so this is an age related factor. Obviously this is nothing but second sight. The next and foremost comes in the second senile cataract is nuclear cataract colors. So basically the colors are of four grades: grade 1, grade 2, grade 3 and grade 4. The grade 1 colors, these are yellow, and this yellowing or yellowness is due to deposition of urochrome pigment. Remember this, the yellowish deposition in this senile cataract in nuclear cataract is due to urochrome pigment deposition. Okay, now the clinical feature in the yellow colored vision, it is called as xanthopsia. Okay, so xanthopsia, this is the clinical condition when the patient complains of a yellow colored vision. Very simple. Now the second grade colors are amber, the third grade color is brown and so called as cataract brunnescence. Okay, so cataract brownishes, this is nothing but the grade third one. The grade fourth one, the color appearance is black and this is called as cataract nigra. So basically in the black peoples, in negro peoples, this variety of grade of color of eye is seen. Okay, the black color of eye is seen in nigra peoples. Okay, so these are the grades of the color of the eye. It could be yellow, amber, brown or black. Now due to the deposition of urochrome pigment, it leads to the yellowing. Okay, so this is basically the image in which you can see there is a yellowing over here in this part, and this is nothing but grade 1 type of pigment. Okay, nuclear cataract, which will lead to nuclear cataract. Very easy. Now another type of senile cataract, that is cortical cataract. Okay, so another type of senile cataract, cortical cataract, also known as peripheral cataract. Okay, also known as peripheral cataract, and there is a loss of vision in the dim light or at night. Okay, so in peripheral cataract, in cortical cataract. Okay, cortical cataract also known as peripheral cataract, and this is nothing but loss of vision in dim light or night. Okay, in the previous one there was a loss of vision in sunlight. Okay, here the vision is lost in dim light or night. Now what is the pathogenesis of cortical cataract? This is hydration of the lens causing soft cataract. Remember when we studied the pathogenesis over there, it was hard cataract and here it is soft cataract. So a distinguished feature the examiner could ask. So the hydration of the lens, and this causes soft cataract. Now in early changes, of cortical cataract, there is a formation of water clefts and vacuoles. Okay, so in earlier changes of cortical cataract, there is formation of water cleft and vacuoles, which leads to soft cataract formation. Okay, after this it will be laminar separation. There would be laminar separation after there is a formation of water cleft and vacuoles. Okay, and the shape would be wedge shape opacity. Remember this, there is a wedge shape opacity in the corneal cataract. Okay, and this type of cataract is known as coniferous cataract. Okay, coniferous cataract, and it is most commonly seen in infranasally. Okay, so most commonly conifer cataract is seen infranasally. Okay, that is the part in the eye. You can clearly see over here conifer cataracts. This is the another image. Conical structures, basically conifers are nothing but conical structures in the eye at the periphery. Okay, so this is the site of location. Another subtype of senile cataract, this is immature, mature, or it is hyper mature cataract. Okay, so basically three more: mature, mature, and hyper mature cataract. The conifer cataract processes to immature cataract. Remember the coniferous cataract which we studied over here. This further processes to immature cataract only. Okay, so it is an updated version of coniferous cataract basically. Now it is seen in the dirty gray color. Okay, so this type of cataract, immature one, it is seen as dirty grayish color. Okay, so you can clearly see dirty grayish pigment deposited inside your eye. Okay, so that is nothing but immature cataract. Now the iris shadow is seen over the lens surface. In immature cataract, the iris shadow is seen over the lens surface. This is the another point. Then the next point, as the fluid accumulates, this dirty grayish colored fluid is now getting accumulated over here. So as the fluid is getting accumulated, it causes swelling of the lens. And immature cataract progresses to intumescent cataract. Very simple. Coniferous cataract progress to immature cataract. Now immature cataract is progressing to intermittent cataract. Okay, after the deposition or the swelling of the lens via fluid accumulation. Okay, and this phenomena is called as mature cataract. Okay, so the intumescent cataract, it is called as mature cataract. Okay, and this is a chalky white colored cataract, and there is no iris shadow over here. So in mature cataract there is no iris shadow, it is a chalky white colored, and in immature one there is a shadow. Okay, there is a iris shadow over the lens and it is dirty grayish color. Now the mature cataract, it further progresses to hyper mature cataract. So basically these are the steps of senile cataract. That first there was a immature cataract, which further by the accumulation of the fluid and swelling of the lens progressed to intumescent cataract, which further progressed to mature cataract, and this is chalky white colored, it has no shadow on the iris. This matured cataract then further progressed to hyper mature cataract. Okay, so these are basically the steps, okay, of the senile cataract. Now this senile cataract, it can be presented as the morgagonia or sclerotic cataract. In morgagnia cataract, it would be liquefaction of cortex. Okay, there would be a liquefaction of cortex. In sclerotic, there is a anterior capsule becomes wrinkled and lethal. Okay, so in morgagony it leads to shrinking of the nucleus. Okay, here there is a shrinking of the nucleus, here is the wrinkling. Okay, now the next, the most common com the most common complication of hypermature cataract is subluxation of lens. Okay, subluxation of lens. This is the most common compilation of hypermature cataract. Okay, the most common complication of Morgagni's cataract is phacolytic glaucoma. Okay, so this is phacolytic glaucoma. You can clearly see over here the Morgagni's cataract deposition. The next after senile cataract comes the subcapsular cataract. What are the causes of posterior subcapsular cataract? These are due to corticosteroid therapy, okay, and this is due to systemic steroidal usage. It can be due to X-rays, chloroquine, busulfate, and neurofibromatosis 2. Neurofibromatosis 2. Now, what all could be the other causes of anterior subcapsular cataract? These are atopical dermatitis, okay, and this is the shield cataract. This leads to shield cataract. Other cause is amiodarone use, okay, then chlorpromazine use, gold deposit. It could be due to acute angle closure glaucoma, AACG. Okay, these are all the causes. Now in the next session we are going to study about the treatment of the cataract, okay, the surgical assessments.